Hey, my name is Dr. Jill Zimmerman, and I am with Elevate Coaching Mentorship. Now, one of the things that we help our coaches with when they're working with their clients or their patients is sort of troubleshooting, what to do when you run into a complex or a complicated patient or client or somebody who's in pain. And one of the things that I see over and over again sort of trip people up is these hip FAI impingements, labral tears, things like that. There's a lot of confusion and I don't know what to do around this. And I just wanted to walk through some of the most sort of basic thing that you can do that's based upon principles that just make sense when it comes to what is happening at the pelvis and the hip itself, the femur, okay? All right, so what I'll see quite often is that the patient or client can't articulate well their pelvis independently, okay? So they can't dissociate movement at the pelvis, but they also struggle to dissociate movement at the femur relative to the pelvis. So you'll see this practically when you have somebody sort of on hands and knees and you have them sort of go into a rock back position here where they're rocking forward and back. And instead of this pelvis being able to just sort of move back and forth very cleanly, you'll see very early that they'll start to sort of tuck everything under, okay? Everything just starts to do this very early. Now, when we go all the way back, yeah, that's supposed to happen anyway. But it happens a lot earlier where it's, as this person's going into flexion, it's sort of taking the pelvis and the spine around with it, okay? And guess what? They're running out of space here, okay? They're running out of space in the front of the hip. Okay, so what we want to do is to be able to clean up the ability of the pelvis to move independently of the femur and vice versa, okay? You'll also see this in something like, you know, a basic core exercise or, you know, a leg lower type exercise, whereas this leg goes down, it'll sort of take the pelvis with it. So everything just kind of gets dumped, okay? Their back arches, everything comes up. And then when they come all the way up here, they'll sort of round their back and this pelvis will round under with the femur. So there isn't dissociation, right? The femur and the pelvis start to move as one unit, okay? There's less space available when that happens, okay? We're not getting clean flexion where we're getting space in the back of the hip, and we're not getting clean extension where we're getting space in the front of the hip. So really cleaning up flexion and extension is super important with this population, okay? So what I'll do to get them started is to just have them in a supine position here, hook lying, okay? And we're gonna go ahead and just cue them to find a neutral pelvis, okay? So I'm gonna have them do a pelvic tilt where we're sort of rolling forward and under, okay? And finding a neutral area, okay? And they might feel, whoa, my ribs are really popped up when I do that. That's okay, we're gonna take care of that, okay? We're gonna have our hands out in front. We're gonna go ahead and reach, not just with the hands, but we're gonna let the shoulder blades actually come across the body, okay? They're wrapping around, and what that's doing is it's creating nice broad space in the upper back. So as you reach, you kind of cue that you wanna feel like the upper back is sort of stretching out, okay? And then you're gonna take a breath, and you're gonna take a breath in, and then you're gonna exhale and keep that reach. As you exhale, you're gonna let all that air out. And keep reaching and keep reaching and keep staying heavy through the pelvis and keep staying long through the spine, okay? So that as you reach, you don't drop everything. It's still long, okay? But we're getting the ribs to come inward and downward as you exhale all that air out. After the ribs get in and down, you're gonna continue to reach and take another small breath in through your nose. Small, not necessarily small, but easy, right? And then let it all out. Okay, so we're just prepping here. We're just trying to get this core canister sort of integrated, okay? Once we've taken a few breaths there, okay, we're gonna go ahead and plant one side, lift the other. Take a breath in. Take a breath out. Now, you also might see with this population, as that leg comes up, the pelvis spins, okay? It kind of drops on one side, it rotates, okay? So what we do for that is we just cue a little bit more reach. I tend to, if, say the right side's lifting up, I might cue a little bit more of a left reach to sort of like bring that person like up and over and on to the other side, okay? Both reaching, but maybe left more than right to kind of drag you diagonally across, okay? And just sense in general, just getting heavier on the side of the pelvis that seems to want to lift, okay? Or you can have them drag with that stationary foot. So there's a few ways that you can get that to kind of stick. Those are the three that I typically go to. And then once you've sort of got that pelvis level on both sides where it's not tipping and you've got that reach, then we're going to go into a little leg lower here. Okay, and what we're focusing on is the ability, like I said, for this pelvis to just stay exactly where it is, not to scoop under or arch out, not to hike, okay, not to tip, just to stay right where it is and allow this femur to reach out into extension, opening up space here, and then come into flexion, opening up space here. When I run out of flexion and I start doing this, I'm not making any more space in the back of the hip, okay? I'm just flexing my spine, okay? So this is really important in terms of opening space in the front and the back of the hip for these, hip impingement, labral tear type clients, okay? So there's lots of progressions to that, but I just wanted to take you guys through my initial thoughts on sort of where I go with clients like this. Obviously, if you want to make this a little bit more closed chain, we can actually just go back to this rock back one, okay? And you can just cue heavy knees, heavy feet, heavy hands, and we're just sort of rocking that pelvis back and forward, okay? We're keeping a long spine, okay? And we're just going to sit those hips straight back, allowing for some flexion here, allowing for some space to happen in the back of the hip, okay? And then if you want, you can come all the way forward here. Really allow them to maybe explore a little reach of the head forward and a little bit of hip extension, okay? Without compensating through there, okay? And then back, and then forward. Long head, okay? And you're just allowing them to explore space in the back of the hip and space in the front of the hip, okay? So I hope that helps just kind of clean up a little bit of understanding. Obviously, there's lots of other things that go into thinking about creating more space in the hip, and I'll also shoot a video that is geared around opening up space on the outside of the hips, because the more space that we can have in the front, side, and back of the hips, the more that femur is going to be able to articulate into flexion, extension, adduction, abduction, internal and external rotation, the more space it's going to have and the happier it's going to be.